What the fuck is wrong with me? Women's reproductive health and the struggle for proper treatment by Kiera Priday. This film will focus on women's reproductive health and aim to uncover the battle women and gender diverse people face to be taken seriously about their own bodies. Through my anecdotal and academic research, it became clear that the dismissal and ignorance surrounding reproductive health and women's pain is a long-standing issue, both socially and within health institutions. There are many statistics to support this. To name a few, women wait longer for pain medication than men, wait longer to be diagnosed with cancer, are more likely to have their physical symptoms ascribed to mental health issues, and are more likely to suffer illnesses ignored or denied by the medical profession. More specifically to reproductive health, conditions such as endometriosis or polycystic ovaries often seemingly go undetected or untreated for years. In my film, I will focus on both reproductive and mental health, looking at the frustration with the lack of knowledge I have about the things wrong with my own body and interviewing friends and family about their own experiences with these issues. This topic is very important to me, having suffered with extreme menstrual pain and many other related issues for years. Just to be told your periods will get better with age, or just to rely on the hormonal treatments, such as the contraceptive pill, which are much more likely to exacerbate mental health issues and cause many other side effects. I have decided to approach the film from a personal perspective, using my own encounters and experiences to inform and frame the main themes I will cover, including feminism and the emotional labour women face as a direct result of reproductive health. Identity will also be an important theme within the film, as issues with reproductive health longer term can cause a disruption to our sense of personal identity. This can require an adjustment to patterns of behaviour, and as a result, how the person with the condition views themselves may change in order to accommodate any effects on their lives and relationships. In relation to a specific reproductive health condition, problems in the social relationships of women with endometriosis have been shown to often arise from a lack of awareness of the impact of it, and these problems can make coping with the symptoms more difficult, leading to endometriosis being referred to as the most lonely condition. This theme will be present in all aspects of the film, with a focus on identity in the questions asked during interviews with friends and family, to allow a wider and deeper understanding of how reproductive health affects people's self-image. The film will utilise several different filming styles. I will use vlog-like clips of myself to document the experiences I personally face whilst going through my menstrual cycle, and also recounting experiences from things such as my doctor's appointments. I will be using this style as I want to evoke a more personal feeling. As the topic brings up many emotional and uncomfortable themes, the vlogs will aim to display this in a frank and realistic way that is not commonly shown. I also want to use a more abstract style, painting female reproductive organs on my housemates and I's bodies, and then using fake blood to disrupt and change the image. This will be a backdrop for more detailed or sensitive excerpts from the interviews to reflect the often unseen physicality of the issues spoken about in the film. Due to the sensitive nature of the subjects being discussed within the interviews, I will take care to explain to everyone involved what the film is about, and a list of some topics and questions will be given to them so that they can prepare and give full informed consent. Their image will also only be used if consent is given. To ensure the safety and comfort of participants, I will also ensure that they are aware that they can stop the interview at any point and that they can withdraw their contributions if they change their mind about their involvement. Due to the ongoing COVID restrictions in place, interviews will be carried out socially distanced in an outside environment or through a platform like Zoom if this is not possible. COVID restrictions have also affected the content of this film, as I wanted to include more of a focus around my experiences with doctor's appointments and attempting to investigate potential conditions. However, this is much more difficult with phone appointments and less ability for testing in general. In terms of the style of the film, I was inspired by Stacey Dooley's documentaries, as she often covers very sensitive issues but manages to approach these topics in an open and understanding way, but she isn't afraid to show her opinion and is very honest on camera. She also creates a very relaxed and conversational style atmosphere with the people she interviews. From this film, I hope to give people an insight into and understanding of women's reproductive health. I also want to learn more about my own body and show how raising awareness of reproductive health and just how common these issues are can improve the lives of so many people.